We have inpatient surgical, and we have the GRG, and we have behavioral health. We do have all three. We use them interchangeably depending on diagnosis of patient. Our behavioral, we have 3 inpatient behavioral units across our system, and so those are predominantly where we use our behavioral health guidelines. But that has really helped us be able to become a little more in sync with those behavioral health payers. They had not been, up until the last 2 years, using any type of guideline. So they were really more making a judgment call based on what they determined to be medical necessity, which didn't always sync up with the payers. And so embedding that guideline piece with their work had really helped to kind of help have that conversation more with the payers, and also to help them show what they needed to help the doctors document if we had gaps. So when they would look at the guideline and say, this is why we feel the patient's inpatient, if they weren't seeing it in the documentation, they could further those conversations with the physician to say, we need to have some documentation to help support this piece of it. So that's been very helpful in that arena. And then we do use the inpatient surgical and the general recovery course throughout our entire facilities to help with those patients that are coming in. I do feel it's a little bit easier with the denials on their piece of it. I think they've seen where they had opportunity. So I think they've seen opportunity where they needed to help the physician documentation be more in line with what a payer is looking for, and also just in general that they had opportunity to do better medical necessity support documentation. And so that kind of was a growth from where we were at from the criteria.